HASANZ represents 11 member associations, 12 member associations across 11 health and safety disciplines. And it represents about 5,500 health and safety practitioners and professionals across New Zealand, supporting large and small business, both within companies and also as contractors and consultants as well. HASANZ set up a register, and we now have about 575 health and safety advisors and professionals on that register to help business understand what their critical risks are and what controls to put in place and how they might support those, the effectiveness of those controls. And over the last 5 years, HASANZ has put over 160 scholarships in the market to really lift up the capability of New Zealand in regards to the advisor community, to make sure that we have people who are appropriately qualified and competent to give good advice and sound advice to business. We've coordinated our submission response across our member associations to make sure that we've got clarity around what we're considering. And we support any effort to improve health and safety, but we recommend amendments which we've outlined in our submission in detail, and we won't go through that today in detail. And it's really about reducing and removing the unintended consequences and confusion that this bill is likely to cause. I'll just quickly briefly talk about some of the one of the components, and then I'll hand over to Joe and then to Joel, and then we'll open for questions. One of the key issues we think is the impacts of a two-tiered risk-based system. It reduces the protection for workers fundamentally, and particularly of small companies. And the second thing is it really complicates supply chains. And so if you think about a small business moving on and working with a large organisation, and a large organisation working on a small business site, and go across any industry, it's quite significant in regards to the complexity that might cause, and the confusion that might cause. The other thing is it's out of sync completely. This two-tiered risk-based strategy is out of sync in regards to other high-performing jurisdictions. So specifically we think of the Australia jurisdiction, UK, and also the ILO. So we would implore you to have a look across those other jurisdictions and just try and understand why are we suddenly thinking that we might have some better ideas to go completely out of sync with the other markets that are performing really highly by comparison to ourselves, and that's well documented through evidence. I'll just hand to Joe.
Thank you, Mike. Thank you, everybody. I'm going to make a few comments specifically about the approved code of practice provisions in the draft bill, which can basically be boiled down to opening up an avenue for industry-developed guidance to be created and then approved by the Minister with the regulator's approval, and introducing effectively a safe harbour provision where an approved code of practice governs a particular risk, where any PCB would be deemed to have satisfied its duties if it complies with that ACOP. We're not terribly bothered by the possibility of industry-developed codes of practice being possible, because it's already practically possible. If an industry group approaches the regulator and wants to develop a code of practice, that can happen. Where we have concerns is around the safe harbour provision, because historically New Zealand's track record on regulations and guidance and standards development and maintaining currency of those things has been very, very poor. So if we start creating approved codes of practice with a safe harbour provision, then what we run the risk of is having lines in the sand, effectively regulations baked into those approved codes of practice that become increasingly obsolete as ways of doing work and technological systems and so forth develop over time. Unless there's some mechanism for updating them, for reviewing them, for some sort of sunset provision or anything to make sure that the guidance is actually being updated, then what we're going to wind up with is actually more complexity for businesses rather than less, especially as best practice develops.
Sure. Thank you for having me. My comments this afternoon will focus much more on the importance of retaining a strong prevention focus in the health and safety system, including worker voice, occupational health, and long-term harm caused by exposure over time. Our concern really is that the bill's critical risk framing as it stands may unintentionally narrow attention toward acute and visible hazards and away from harms that arise cumulatively through work over time. And that matters because the greatest burden of work-related harm is often not acute injury, but longer-term exposure. And I know you've heard a lot about psychosocial risk and harm so far, so I won't jump into that. But this does highlight to us that occupational health needs to remain a priority. These are not secondary issues. They make up a major share of the health-related burden of harm. So the core problem for us is that the bill appears to focus the system more heavily on critical risks with a strong pull towards acute injury and immediately visible harm, combined with the small PCBU carve-out that was mentioned by Mike. There's a real risk that broader occupational health harms become less salient in practice. And we feel the legislation should preserve prevention, worker voice, and a clear focus on occupational health, including cumulative harms. If those harms are given less prominence in the framework, the harm does not disappear. The costs are simply shifted elsewhere.
Wonderful.
Excellent work.
Questions. Wonderful. We have the first question from Carl Bates.
Thanks very much, Chair. You make a number of comments regarding the overlapping of the legislation in terms of point 7, deemed compliance, 4.7. I want to tease out your concern a little bit more around where a piece of legislation has been worked through, included specific health and safety requirements for whatever that industry or issue is, that you don't think that that would be strong enough to allow for deemed compliance?
I'll probably just take a first comment on that. So I might hand over to my colleagues. The key issue for me is that a number of those other pieces of legislation are sometimes out of date, or not so much out of date. From a health and safety perspective, they're quite aged, and some of those would go back to multiple tens of years. And so what we'd effectively be doing is degrading our health and safety laws in that particular sector in relation to that particular legislation to something that might have been put in place in the 1950s or 60s. The Railways Act comes to mind. There's quite a number of different pieces of legislation, and would need to go through and say, okay, for every one of those pieces of legislation, do they degrade or improve the health and safety to our workforce?
So if they were either updated or a similar approach to the codes of practice where these ones aren't included, but going forward, that could be the rule, would that satisfy your concern?
Yes, it would. But my concern is the effort that takes and the time that takes. And this law, as my understanding, will come into effect as soon as it's passed. And so I think we'd have a complete disconnect for a period of time.
Thank you. Dan Rosewarne, next question.
Thanks, Chair. So Joel, you just mentioned you had a focus around prevention. What's particularly troubling with the bill, in my view, is that there's no consequences for businesses that do not prioritise critical risks. And I was just wondering how you think the bill could be improved so those critical risks are prioritised by businesses.
Well, Dan, I think that's a good question, and I think that there are a few parts to this. In the first instance, I agree around the lack of prioritisation. There could be some amendments made around the importance of prioritisation, but we also have to address the core problem around the PCBU carve-out, because even if we address the prioritisation element of that, we still have a large majority of enterprises in New Zealand who will not be required to manage the more general elements. One thing that could also be changed is the inclusion of things like psychosocial risk into a critical risk framing, if that was the direction that this took.
Thanks, Joel.
Thank you. Thank you very much. A very comprehensive submission. Thank you for being part of the process and joining us today.